The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Peter Eckert from the Illinois Public Health Institute. I'm one of the co-directors for Data Across Sectors for Health, and I want to welcome you to this webinar today, where we're going to be talking about the Community Impact Contracts opportunity currently live through the Robert Wood Johnson Foundation. And so let's go to the slide that talks about how we are going to work together today. Thank you. Susan Martinez is going to be staffing the management of the slides, and other folks on the DASH team are also participating today. And so there's going to be two primary ways of interacting with us. The best way is to ask questions in the submit your question box. We'll also have an opportunity at the end of the webinar where you can raise your hand and answer. Wow, you'll be able to raise your hand and then you can ask your question and we will try to answer it. Questions and answers is really one of the most important things we're going to be talking about today. And so we'll continue to get to that. Next slide, please, Susan. So we've got a pretty basic agenda. We're going to talk for about 30 minutes, and then we're going to talk together for about 30 minutes. I'll walk you through an introduction to DASH and All In, and then my colleague, Melissa Moorhead, we'll walk through the details of the Community Impact Contracts opportunity, and then we'll go to questions and answers. And so you can ask questions at any time over the first half hour, and some of them may get answered in the chat. The ones that are not answered there, we will answer in the second half hour. I also want to point out the fact that there are handouts of the slides available to you within the GoToWebinar control panel that's probably on the right-hand side of your screen. And even though we're going to be talking today about the Community Impact Contracts opportunity, I also just want to recognize that we have open right now a second DASH opportunity called the LAP program. That's Learning and Action in Policy and Partnerships. That information about LAP is at dashconnect.org/LAP, in the same way that the landing page for the CIC cohorts is at dashconnect.org/CIC. And so we'll be having a webinar for the LAP on Monday, and you can get information about registering at the LAP homepage. So let's jump into talking about DASH. I know that some of you have had some experience with DASH, but we'll go over the basics, and then of course all the information that you'd like to know is included at our website at dashconnect.org. So first of all, I just want to say that DASH is a partnership between my organization, the Illinois Public Health Institute, and Melissa's organization, the Michigan Public Health Institute. Together, we run the program office for DASH that's supported in whole by the Robert Wood Johnson Foundation. Next slide, please. So this slide does not represent anything new for you really or for any of us, but we like to put it right up in front because when we talk about multi-sector data, we're talking about the varieties of ways that many community institutions and people have an impact on individual and especially community health. And so where it was once true that people thought of health as being generated at hospitals and doctors' offices, now we understand that health is generated by a complex interplay between things like public health and clinical health care, between education, housing, and increasingly we're understanding the important roles of community-based organizations and social services. Also gaining much more traction in our conversations is the key and foundational role held by community residents and people with lived experience of the very things that we're trying to address together in our collaborations. So that's what we mean when we talk about multi-sector data, multi-sector strategies. Next slide, please. For DASH, we've been around for about 5 years, and the way that we think about our work hasn't really changed in that 5 years. We have always been focused on 3 primary things, and those 3 things are a multi-sector approach, as I just talked about, shared data and information, and a community collaboration approach. And so, initiatives that include all 3 of those are really the DASH wheelhouse, and it's all focused on improving health, well-being, and equity in our communities. Increasingly, we're understanding that all of these things have a really strong interplay with social forces that are addressed in policy and systems change. So we talk about 3 strategies that all work together to advance this idea about how do we change the systems under which and through which we all work. And so those 3 strategies are building community capacity, building the evidence base for what works, and building a movement together. And so those 3 strategies are a part of most of what we do at DASH. They are certainly all a part of what we're doing with the community impact contracts. Next slide, please. So DASH right now has 3 primary funding programs, 2 of which are open currently and 1 of which will be open early in 2021. We're talking about the community impact contracts. Some of you who are familiar with this program in the past understood it as Kickstart. And so I'll talk a little bit in a second about why we're now talking about CIC-Cohort. But the basic parameters of the programs hasn't changed. We're still going to be offering up to $10,000, $25,000 grants that are going to be executed over about a 6-month period. And it really is trying to address the things that we've said as our focus, an opportunity or challenge for multi-sector data collaboration. I spoke briefly about our brand new learning and action and policy and partnerships. That is a brand new program for us. We'll be awarding up to 5 grants of up to $100,000 to community and state partnerships. So a key difference here is that the KIC program is focused on very local community collaborations. The LAP program is focused on the interplay between community and state government. And then finally, our program that really is intended to support folks who are earlier in the process of developing their community collaborations and their data sharing systems is covered in our DASH mentorships. I'm assuming that no one has spoken up, but I do see we have a question with one person who's not able to hear us, but I'm going to keep going. Next slide, please. So a little bit about why we're now talking about a KIC cohort as opposed to a Kickstart program. In some ways, the focus of the program hasn't changed. And so, for instance, when you look at our FAQ document, we've got 7 pages of questions and answers that we've created over the course of the first 5 rounds of Kickstart. But what we have learned is that there is a powerful there's a powerful set of learnings that happens when people are working together inside of a cohort. And we've learned that really significantly by our work with All In, but also through DASH's mentorship program. And so the mentorship program, if you're familiar with it, has an individual mentor that works with a cohort of communities. And so we've picked up that idea and we are kind of laying it over what we're trying to do with the KIC program. And so, some of the details of that are still being worked out, but we're excited about that addition. And so for the purposes of this first set of opportunities for KIC cohorts, we have settled on two things that are very important to the communities that we traditionally work on. Melissa will talk a little bit more about this, but they are both wide enough to include a lot of different kind of approaches in your community, but also narrow enough that we think that we will be able to create a nice cohort. And so those two things are, and yes, I'm just going to read them. Collaborative projects that are pursuing equity, especially racial health equity, and data systems development intended to improve community health, well-being, and equity. Then the second cohort is going to be focused on increasing the sustainable capacity of community-based social service organizations to lead and leverage collaboration and data system development, again, intended to improve community health, well-being, and equity. And so certainly you might be thinking of a project that could fit in either of those two cohorts. We really kind of want to, we want to make the distinction there that the first cohort is really pointed towards collaboration, data sharing for equity, and the second one is about is focused on increasing the capacity of community-based social service organization to lead these efforts. Next slide, please. I'm going to race through these because I only give myself 10 minutes for this. And so there's a picture of the DASH framework up on the screen right now. And that's really, we're not going to talk about any of that today, but I just do want to say that we have a way of understanding what happens in communities as they seek to collaborate and share data. And we use this framework to kind of structure the synthesis of what we're learning. Because even though it's very important for us and exciting for us to get resources into communities, it's really in the service of learning what works and what doesn't work so we can share those lessons more widely. Next slide. DASH is one of 7 partners in All In. And All In, you'll see that we have supported, it says 150, really it's over 200 communities that have participated in All In data for community health. And so DASH is one of them. And so all of these organizations contribute staffing and community participants in a big learning collaboration. And so you will discover, if you have not already, that one of the requirements for the application is that you are a member of All In. Now, it's a very low bar if you're not already a member to join All In, and so Melissa will talk about that. But we make that a requirement because it's important for us to be creating a space within an active network where your lessons will be shared. Quickly going over the last 2 slides. The All In network, if you're not already familiar with it, next slide, please, includes all kinds of things. And it includes publications, an online platform, lots of different kinds of visits, webinars, and our newsletter. Last slide, please, or next slide for me. The way to join is to go to community.allindata.org. You'll set up a profile, and then Melissa will approve that, and then you'll be on your way. Melissa, I went over by 10 seconds. Please let me set it to you to talk about the actual opportunity. And again, as I walk out, my encouragement to you to put questions into the question box. Please go ahead, Melissa Moorhead.
Thank you very much, Peter. I've already seen a question come in, so I'm going to look at that right quick. You need to be a member of All In to apply to the opportunity. Sandy, yes, we do want to make awards to members or to people who are ready and interested in making a contribution to the All In network of all kinds of national level partnerships and local level communities addressing data for community health. And there's a couple reasons to do that I think Peter had started to allude to, and I will get to as well. One of the main reasons that we do set that as a bar for eligibility is that it is free to become a member of the online community. We don't part of our sustainability goals for the All-In Data for Community Health membership is that it will be self-sustaining just by individuals contributing and participating over time. Different partners can come and go, but the membership there will be sustained as those funding opportunities or members come and go or partners come and go, because we believe in the power of peer collaboration. That's a big part of DASH, and it has been from the beginning, and it's definitely a big part of how we want to amplify our message and support our local awards by paying attention to the value of peer collaboration and a national network of people who are facing the same challenges or sharing potential solutions, asking for input into different approaches that is just a benefit to being part of a project that is an awardee of an All-In partner. And Peter did skip over the slide of some of the benefits in terms of All-In partners do make substantial support available to participants to do site visits. I know in a time of COVID, no one knows what any of this will look like moving forward. But to the extent to which we can help different projects or communities learn about what's happening across the nation and set up conversations, we do set up convenings. Used to be more in person than virtual, probably is going to be more virtual moving forward, but convenings around particular elements of the work. If you're working in the homeless sector, for example, we've had a couple convenings of different communities and projects who have looked at how to make multi-sector collaborations to better support community members experiencing homelessness and addressing some of the upstream factors for that. We have a national meeting every year that DASH does try to make scholarships available for all of our current awardees or all of our active awardees at the time of the national meeting, so that you can go and participate in a robust conversation that's driven both by presentations and also by opportunities to chat with your peers around these different considerations. For DASH, I do know that a lot of our positive feedback for those opportunities are just in the realm of DASH gives an opportunity or a space to focus on the data infrastructure and the data use cases that multi-sector collaborations eventually get to. We do have those other opportunities. The mentorship, for example, very good for upstream sort of opportunities to discuss where you might want to make new partnerships, and have some support for that. And then the more robust local and state collaborations. But that all of that kind of depends on and can be sustained through the all-in peer learning collaboration. So that was a lot of words for a pretty simple question, the answer to which was yes. We do expect that the applicant will be able to identify a part of their collaboration or a project staff person who is actively participating in the all-in online community and other networks. So one of the things that we have addressed a little bit on this call, and I'm definitely interested in whether there are more questions about what we mean by the community impact contracts and what's the difference between the kickstarts and the CIC-Cohorts. We did take a little bit of a shortcut early on because we have been offering these community impact contracts over the last 2 years. And our goal behind these, or our programmatic desire for the community impact contracts, is that we know that all over the nation, there are many reasons that at the local level, different organizations will want to come together and start to talk about some of the community conditions, which some people call social determinants of health. That's a much bigger conversation. But some of the things in which different organizations in a community want to address or understand better in order to build a culture of health in your own community. So that's been going on for some time. DASH has been around for 5 years. The Robert Wood Johnson Foundation articulated its culture of health approach also 5 or 6 years ago. And so we know that whether you're trying to enhance an individual's personal wellness or your overall community well-being, it's gonna take a multi-sector approach. It's a complex landscape and no one entity can do it alone. Healthcare definitely feels a lot of pressure to be addressing both individual health problems and the community conditions that might be brought to bear to help improve individual health outcomes or prevent them. But there's also, on a much larger scale, institutional and systemic problems like systemic racism and other impacts on the wellness of a community and, in the end, the health of an individual, that we're interested in learning more about and supporting approaches to do that. So the purpose of the community impact contract and the cohort of view is the same as the purpose for almost all of DASH funding, that we are really interested in supporting multi-sector collaborations, whatever that looks like and however that shakes out on the local level. In this particular instance, we believe that there are multi-sector collaborations that have already started across the nation. We know about a good number of them, but we're looking to, learn about and support even more, where people and organizations have started to come together and maybe have identified a specific challenge that, as Peter is fond of saying, money can solve. Like, what is a particular challenge to where you are now in your multi-sector collaborative work that we can help you address by providing both monetary support in your work plan, however you define that in your application, and by providing some broader support through peer learning and collaboration through All In and through the cohort building that we want to do, specifically around equity and increasing the value and or recognizing the value of community-based organizations in these multi-sector collaborations in terms of their impact on individual health and the community well-being. So thanks for that question, and I hope I've addressed this slide. So next slide, please. I'm really trying to open up the space here, and I do see some questions coming in, so thank you very much, where we can address specific questions and help make your application process easier. One of the things that we are very sensitive to is that a $25,000 6-month award isn't very much. It doesn't do much to address the systemic racism or community conditions or any of the causes of your particular community condition that your coalition might be trying to address. But we are trying to, again, facilitate a step in your process, and particularly in your attempts to build a data infrastructure or a data sharing infrastructure in particular, or analytic infrastructure to help make you more effective at addressing those conditions. So we do consider these awards as pretty broad in terms of what you can use them for. Thanks to the generosity of the Robert Wood Johnson Foundation and the things that they are interested in, there is a case to be made for all kinds of different activities that will help your multi-sector collaboration become more multi-sectoral, become more robust, become stronger, become more inclusive, and be more maybe even shift some of the dynamics in your community away from traditional seats of power to community-based organizations and activities that we believe will become more important over time when we are trying to focus on equity and the community-based organization approach. So this is, again, a very busy slide. I'm not going to read it. It's included in the brochure that we have published. But it is an invitation for you to be thinking about the different things you can do as long as you make a case for how we can be supporting that for this award. So this particular timeline, we do want to start 2 cohorts by the end of the year. We envision cohorts of being a collection of communities who are already in multi-sector partnerships, working on shared data infrastructure. You can apply for any amount of an award, up to $25,000, and we'll help create the cohort for you and provide subject matter expertise in order to help you address the equity issue and the community-based organization issue. The 2 awards that are the 2 cohorts that we want to get started this year are just the beginning. In the next year to 18 months, we do imagine having another 3 cohorts kicked off. And to some extent, those cohorts, we will be sensitive to the questions or issues that people are wanting to address, and we may have different cohort themes in the future. So next slide, please. Again, the eligibility criteria, we are trying to enhance the efficacy and ability of nonprofit organizations to drive nonprofit, multi-sector collaborations. So we are looking for organizations that are already in documented multi-sector organizations or collaborations that are working to build a culture of health. We are looking for those that are far enough along in understanding data and sharing data that they have identified a problem that we might be able to help solve. And that's part of what we mean by the use case there, that what is the community impact contract going to impact. We do require an active team member profile and all in to make sure that we are attending to that peer collaboration. And of course, you must be a nonprofit or a higher education entity in order to qualify for these funds. Next slide, please. The selection criteria, again, this is copied right from the brochure, so I invite you to look at these and read the brochure, and if you do have specific interpretive questions, let us know. We don't have a rubric that you could really address in terms of how to make sure that you score the best, because this is an emergent field still. The extent to which different sectors and different organizations need to share different kinds of data and the impact that will have on community conditions is something we're still exploring and still trying to support. And we do believe is very local, right? Your individual community may not need the same things or may not be doing the same things as another community. And that's fine. That's something that we need to learn more about and learn how we can define or understand the elements that may need to be in place for any community to move forward, in which case you might be a mentor or a guiding light for others, or at least be able to be the cautionary example, like here's what we tried and it didn't really work, and now we need to try something else. So it's fine also to be thinking about to the extent to which you have maybe tried to reach out to other sectors and not been successful, or believed that if you just had access to payer data, for example, or some other system, you might be able to move forward, and that didn't quite shake out. This is exactly why we are asking you to participate in All In, and we're interested in funding different experiments and proposals so that we can try to help people both move forward or further if they have the same approach, or if they are going down a path that may be able to be addressed, or we can provide some guidance, or their peers can provide some guidance about where not to go. That is something that we are looking to support as well. So the main selection criteria, again, is the strength of the multi-sector collaboration, the understanding and or the question or the desire to understand a specific data systems approach, the understanding and ability to attend to potential bias in your data system approach, or in the collaboration itself, if it doesn't include people in the community who are experiencing the conditions you're trying to address, or who's historically experiencing health inequity. We'll be looking at proposals who are already doing or paying attention to some of those questions. We do have on the dashconnect.org site pages where you can see who has been funded in the past. Many people find that helpful in trying to understand whether or not their application might be successful. I would caution against taking that too seriously or use it or letting that be a roadblock. Again, DASH is very interested in all kinds of different approaches and very sensitive to the extent to which those are variable according to local community conditions. So if you don't see yourself in a prior project, that might be a benefit and not necessarily a drawback. Next slide, please. Again, we had the big slide earlier, different ways you could use the award in order to enhance your local, your work at the local level. We do also, as DASH, have a number of learning goals or reasons why we're fielding this opportunity, and the ways that we think that we can help make a bigger impact at the local level. So this is, again, a non-exhaustive list of different things that we do in order to help support our awardees in achieving success in their own context, and also work with different communities to help understand the field as a whole and do what we hope to achieve. So next slide, please. This is a slide just basically about how to apply, what the different sections are. Again, it's meant to be encouraging in terms of we only have a few different application requirements. The main elements are in the project information questions. There's about 5 narrative questions. There is there's a questionnaire that you'll get about your community collaboration to fill out, but we really do want to make this a low bar to apply so that we'll get more, so that you'll be able to make a good application in the time provided. And we're happy to answer more questions or solve any issues you have about the application process or requirements as we go along. Next slide, please. Yeah, so there's the timeline is obviously part of the process. Hopefully, if you have had any questions come up today, you'll be able to ask them live, or we will collect any questions that have been submitted for our FAQ document. A lot of the elements, as we've said, are similar to other opportunities we've made available, so you can go ahead and dig into some of the FAQs available. We are anticipating closing off awards November 13th at 3:30 p.m. Eastern Time. I just want to flag that it is before the end of the day, and that's because we are all people who are working on systems. In this case, it's the Robert Wood Johnson Foundation system that is located on the East Coast. We close it down at 3:30 because sometimes there are mechanical problems that can be addressed before the end of the day, and that's when you'll have your opportunity to be hitting submit on all of your different sections, and should something go wrong, we'll be able to catch it. We'll spend a month or so reviewing and talking to people about their applications, and then make the awards before the end of the year, and look forward to 2021 when we dig into the performance period. And again, as a reminder, over the next year in 2021, we'll have additional cohorts available and funding opportunities that we'll be interested in hearing or getting some new applications for. Next slide, please. These 8 tips for a successful application are, again, very process-based. They have to do with the Robert Wood Johnson Foundation application system. The main points to be mindful of here is that it is an online system, please save early and often. As long as you don't submit and you just save, even if you say save section finished, you'll be able to go back and make changes. Anyone you invite as a collaborator will be able to go back and make changes before things are submitted. But the system does time out, and you don't want to allow that to happen while you're in the middle of trying to update your answers. So do be mindful of inviting your collaborators and saving your questions and your answers very early. And where you do have questions or problems, reach out as quickly as you can. You can reach out to me directly. There's a help button on the Johnson site, and we'll try to make sure to address that as soon as possible. Next slide, please. It's the ladder for 8 tips to actually creating that successful application. And that said, we, I think, have come to the end of our presentation. And again, we have a number of FAQs available on the program information site at dashconnect.org, CIC, for community impact contracts. We did get a question that we get from time to time about whether universities are eligible to partner with extension agencies to collaborate. The answer is absolutely. Really, they're the only bar to who can participate, who can be awarded the money, is in that 501c3 designation or nonprofit designation. We are happy to consider all kinds of different collaborations and different participants in those collaborations, and different leaders for those collaborations. We have funded organizations who, you know, might be a health information exchange and have a different business relationship to participants than you know, community-based social service organizations have. So we are happy to learn more about and fund different types of collaborations. We do have in this particular opportunity, as we've mentioned, the intention to support community-based organizations and the community members that they represent, taking more of a leadership role in those activities. But there's no bar or automatic DQs for how your particular community has decided to come together to address a particular condition or build a culture of health that is dependent on your local conditions.
Hey, Melissa. It's Peter. Hi there.
Go ahead, Peter.
I just want to say that I have been trying to answer people's questions as they've come in. So I wonder if we can circle around, and these are great questions, everybody. Thanks so much. I wonder if we can get around to some of the ones I haven't typed at yet. And so maybe I can ask a question, you can try to answer them. We've got about 15 more minutes to do questions. And so folks, please continue to ask them. Melissa, how many letters of support are required to apply?
That is going back to the different types of collaborations that we're interested in. There isn't a minimum or a maximum number of letters of support. One of the reasons that we have the ability for you to upload those letters of support and encourage you to do so is the extent to which we are trying to understand how ready your entire collaboration is for this opportunity. So where there are partners who are very specifically impacted by the data system that you are trying to enhance or you know, move forward with your application, we would like to see that those different important organizations in your community collaborative are aware and bought into that and are willing to participate in it because we know that they will have a big role in ultimate success. But there isn't, again, there's so many different ways and uses for this opportunity. We couldn't possibly imagine who needs to submit a letter of support or how many. It really has to do with thinking through how you have described the project, what your collaboration looks like, and then who are those key members that will be participating in the activities, the award supports, and be able to report on the resulting increase in capacity.
Great. Melissa, let me cue you up to answer the question about how we define community. But as you're thinking about that, let me answer actually the last question that was asked. It says there are no requirements in terms of abstract proposal, budget proposal requirements shared. Can you explain what exactly does the application contain or ask for? So Melissa did address that a little bit on a slide that we can throw back up. Susan, if you can throw up the slide that has the application process yep, right here. And so the application requirements are listed on the side, and the best way to understand exactly what's required is to create an account at RWJF. It's my.rwjf.org. And once you've done that, you'll be able to see the actual application that you would use to apply. And there is guidance in the brochure. There's guidance in the FAQs that we'll be posting by tomorrow. And within the application system itself, there's additional guidance about how you respond. I will go to Melissa for the community definition question, and then we'll keep working our way through.
Thanks, Peter. I'm also looking to put up the actual application link for this opportunity. What you said about creating an account at my.rwjf.org is just good advice. Robert Wood Johnson Foundation makes all kinds of different funding opportunities available. This one is only available through the link that you'll find at the dashconnect.org/CIC page, and I will post that in the answers later, and you'll find them. You'll find it again on that page. It can be. I know that some people have run into problems if they have made applications to the Robert Wood Johnson Foundation previously. You won't see this particular opportunity available in the list of the opportunities that they are making available. Again, because we are a program office, and it's a opportunity that is specific to DASH. So when we're talking about community, I know that we've had some issues in the past with locality. If we do say local community, some people wonder where we're located and what's local to that. That's not a concern. This is a nationwide opportunity. So however your collaboration defines your scope of impact, or what makes sense for you to do that enhances all the stakeholders' opportunity to contribute to and benefit from the activity that you are suggesting, and the potential for data sharing, where we will take all of those types of applications. So occasionally, not even occasionally, I'm from public health, so I know that there are communities that are built around specific individual health conditions. There are more communities that are, very worth supporting in terms of community conditions that need to be addressed. and perhaps might be best addressed at a national or a state level. In order to address those, we do have the other opportunity available. That's the learning and action in policy and partnerships. For this particular opportunity, the community impact contracts, we're looking for the community that is ready for and will benefit from a very targeted small amount of money and time in order to enhance their collaboration and the data sharing activities that they're trying to accomplish. So hopefully that is enough guidance to not worry too much about how you define activity or community. But go ahead and be thinking about, it's in the eye of the beholder. If you're in a geographically localized partnership or collaboration that's looking to enhance or build the community of health, we're definitely interested in supporting that.
Thanks, Melissa. Let me dispose of a couple of quick questions. One question here is, can funds be used to fund software, package, or consultants? The basic answer is yes. And in fact, a consultant that you would engage to address a particular problem or opportunity is a very reasonable use of CIC-Cohort funds. We have also funded the purchase or licensing of software or some software components in other Kickstart programs. But I just want to also call to attention the fact that this is intended to build the capacity of community collaborations, community organizations to collaborate and share data. And so, as Melissa suggested, the award is at $25,000. And so what you would want to do in the proposal is to describe how the consultant and or the software that you would purchase would be part of a long-term solution to the problem or opportunity. If it's a drop-in solution that creates something that can't be maintained or only is able to happen for 6 months, then that's probably not a strong application given what other people will be proposing. All right. There's also a question, Melissa, that I wanted to throw to you, which I thought was really interesting. You mentioned that an example of use of awards can include connecting with an API, leveraging an open data platform. Are there any current CIC awardees who are currently looking into or using an open data platform? And I thought you could also use this question to talk a little bit about what people get out of being a part of All In.
Thank you. That's almost too exciting for me to be able to answer in the time we have available. So there, again, I would point you to connect.org, the awarded communities for some insights into what we have already funded. So yes, we definitely have examples in our past awards that would answer to that. More broadly, we are aware through our All In Data for Community Health network of both program offices and different communities of different approaches to using APIs or getting over those specific technical hurdles in different ways, whether it's a vendor or a particular technological approach. And we are definitely interested in supporting communities. How do I want to say this? We're definitely interested in supporting relationships between different local collaboratives who may be looking at the same approach or maybe seeking a common approach or how to support each other when it comes to understanding some of those really nitty-gritty opportunities or challenges for data exchange, data sharing, data analytics, and what you might be able to do together in order to make broader recommendations, both to philanthropy funders and for different governmental or regulatory entities that might be more responsive to your perceptions of how to get this work done on the ground amongst your collaboration. So that's a great question. Whether or not it leads to an application for this particular award, I hope that it leads to participation in the all-in online community and seeking out a collaboration of your peers across the nation in a way that will help us build the cohort approach and other ways to support communities working together on common challenges.
Thanks, Melissa. I want to answer a question that we just got from Jen Costello, which I'm not going to read the whole thing. I'm going to read the opening part of it. In some of the materials, there is a reference to ensuring that the grant has a benefit for non-healthcare agencies. Could you expand on that? For example, would care managers and social workers within a healthcare system count? That is a really nuanced question. And it does point to kind of what's happening in the landscape of this work, right? Things that used to be the province of social service providers are now sometimes becoming services that are offered by clinical care settings. So I think that the proposal guidance in the brochure and in the FAQ is that that we're really looking for organizational collaborations that includes distinct participation from healthcare, public health, and community-based social service providers, or non-clinical sector partners. And so that what you described sounds like it would probably be the social service function within a clinical healthcare setting. It may be that your proposed use case and project is compelling and compelling enough, with partners that are primarily based in healthcare. However, our guidance to you might be to consider would there be ways to strengthen your use case or your intervention by engaging other people in the other sectors in the community from social services and or public health who would really round it out. This goes back to the earlier comment that I made when I was describing the nature of multi-sector data approaches, is that we believe and we think the evidence through our experience is that organizations that collaborations that have multiple sector participation have a better understanding, a deeper, more holistic understanding of individual and community health. And so I'm not trying to be vague in our answer, but your question is a nuanced one. I want to recognize that we are near the time that we scheduled. I think Melissa and I would be happy to stay on and answer the questions that are on, but I also want to just make a quick point that as you leave the webinar or in the email you get from us that follows within a day, is that we're very much wanting to have a response from you to the evaluation questions. We really want to know if this worked for you. So please look for that when you drop out of the webinar or when you get the follow-up email tomorrow. Melissa, anything else you want to say to the people who have to leave right now, and then we'll just stay on and get to their questions.
I'm actually answering one right now. Just please do consider joining the All In community by participating in the online community, community.allindata.org. I am typing out an answer right now, which you'll find in the frequently asked questions. So return to the project homepage from time to time to look for new answers there. In the end, to the extent to which you can go ahead and take the plunge, we would encourage you to apply and maybe you know, tell us a little bit more about what's happening with you and shape our programming into the future.
Yeah, the final, and it looks like I think that Melissa, you just answered the question. There's no limit to people in an organization can join All In. The more the merrier. It's what makes the network work. In fact, I do want to encourage anybody who found our answer not specific enough to go ahead and ask your question with as much detail as possible. While the opportunity is open, we can't meet with you individually. We can't respond directly to your question, is this a good idea? But what we can do is, continue to point you to the guidance that's available online, and we will be as responsive as we can to your questions. Our desire to support health, well-being, and equity extends to this process. We want to make this as fair as we absolutely can. I think, Melissa, that we've answered the questions that are there. Is that correct?
I don't see any, and I'm also looking for any raised hands. I'm definitely answering questions as we go forward for those who are trying to apply. So we will, again, be monitoring info@connect.org and other questions to resolve your issues and try to make your application process as easy as possible.
Great. So thanks to Melissa, to Susan Martinez for managing the slides. For those of you who are interested in the LAP program, that webinar is on Monday. And you can find out more about LAP at connect.org/LAP. On behalf of all of us at Data Across Sectors for Health and from our supporters at RWJF, thanks very much. We appreciate very much your interest, and we'll look forward to answering your questions in the coming weeks. Take care, everyone.